Welcome to SheTV.com, where board-certified physicians talk to you about women's health. This video is about whether or not to have your ovaries removed when you have a hysterectomy.
Hi, I'm Bailey. I'm a recovery room nurse here at Lakeside Women's Hospital, here with Dr. Dana Stone, board-certified OB-GYN, here to talk about hysterectomies today. Hi, Dr. Dana Stone. How are you?
Hi, I'm great. Glad to be here.
Good. Awesome. Well, I had a few quick questions for you regarding hysterectomies. One thing that I know we have a lot of patients ask about is when they have their hysterectomies, should they also go ahead and have their ovaries removed? What kind of is the time range and age range that is beneficial versus not beneficial for our patients?
Yeah. So hysterectomies are very common and are done for a lot of different reasons. And so we should probably have a whole other session to talk about that. But there is a new study out that's helping to give us some guidance on how to approach whether or not to remove the ovaries at the same time that a woman is having a hysterectomy. So you're in there, you're doing a surgery. It doesn't really add to that much to the time or to the complications of the surgery to go ahead and take out the ovaries. But there are some benefits to keeping your ovaries, and there's some benefits to removing them, and they seem to very much be age-based. So in the past, we've said as early as 40 years old to go ahead and remove them. There was another study before this one that sort of indicated maybe even till 65 you should retain your ovaries. The basic information is that for a woman at the normal risk of ovarian cancer, and this would not apply at all to women who had an elevated risk of ovarian cancer, but for women at a normal risk of ovarian cancer, which is about 1 in 70 women over their lifetimes can eventually be diagnosed with ovarian cancer. That would be the main reason, the main benefit to removing the ovaries if they're otherwise normal. There was a good study recently, though, that looked at all of the risks and all of the benefits. The risks to taking out the ovaries, especially at very young ages, are you can start to lose bone mass, you can start to have higher risk of heart disease because you don't have the protection of the female hormones. So the newest recommendation is that probably about age 50. So the average age for menopause naturally is 51. So this new recommendation, based on a lot of data and a lot of research, is having us recommend around 50 is the time where the benefits of taking out the ovaries are higher than the risks of taking out the ovaries. And so it's kind of nice to have, this is a very common question that our patients ask us when we're talking about hysterectomy. And so it's kind of nice to have this new information based on a lot of good data and review of the risks and benefits for women.
What is the recommendation for hormone therapy after having your ovaries removed?
Yeah, that's a great question because as opposed to a natural menopause, which is gradual, when you remove the ovaries, it's a very abrupt menopause, abrupt cessation of those female hormones. So any woman that is going to have her ovaries removed before the natural age of menopause, we would recommend she consider going on estrogen replacement through the natural age of menopause, 51, 52. If she's already in menopause and has not been taking hormones, then she has no reason to really start them. If she has already gone through menopause and is having the ovaries removed, then she might want to continue the same amount of time that she was planning to. And that's a whole other topic of discussion, is risks and benefits of hormone replacement therapy. But any woman who has her ovaries removed before the natural age of menopause that doesn't have a reason not to be on hormones might want to consider that through the age of 51 or 52.
What are the risks and benefits of that hormone replacement?
The benefits are kind of what we talked about earlier. You're maintaining your natural state if you have your hormones, if you have your ovaries removed before the
Right.
initial age of menopause, you're retaining your natural hormonal state, and that protects your bones, that protects you from heart disease. So those are the main benefits, and not to mention not to mention the symptoms.
Right.
So the women with their hot flushes. Yeah, that's the very much lifestyle and quality of life indication for taking hormones as well.
Okay, cool. Do you want to talk about risks?
Yeah, for a postmenopausal woman, she needs to talk with her physician about how long she may want to continue to take hormones after menopause. 5 years or so after menopause, as we have a lot of good data that is safe. Beyond that, then that's a risk benefit, quality of life. We have other medications that can help you with bone density. So there are other things that you can do after you've been on hormones for about 5 years or so after menopause.
Yeah.
And that's a very individual decision to make between a woman and her physician.
Cool. Well, thank you, Dr. Stone, for talking to us today about this interesting topic of hysterectomies and the possible removal of ovaries. Thank you. We look forward to speaking with you again about other interesting topics regarding women's health.
Thanks. I look forward to it.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please check back often, as we will be constantly adding new content. If you have any questions or particular subjects you would like us to address, please email us at shetv.com.